Hi there. My name is Jack, and I am here to teach you about pain. I understand you have had pain for a while, and that has been a long, frustrating journey so far. It may help to understand the causes of pain to understand where your pain may be coming from. First, there are two types of pain: acute and chronic. Acute pain is what all of us are very familiar with from the time we were babies or young toddlers, where we would fall, scrape our knees or elbows, and have a burning or sharp pain sensation. This occurs when tissues are damaged, which specific nerve receptors in our skin detect and sends a signal to our brain through nerves, our spinal cord, and to our brain to tell us that we hurt our knee and exactly where that pain is. This response serves us as a safety feature in our bodies as it tells us where we are injured and to not cause any more injury to that area so the body can heal. It is a key survival component. It does actually help us. Acute pain is easily defined from a biomedical perspective because it is obvious about where the pain comes from. It can be easily treated with drugs, including ointments, stitches, and wraps, and the results from these treatments are usually very positive and fast, with only a scar showing the remnants of the sources of pain. Chronic pain, on the other hand, is persistent and seems to never go away. There aren't any sources of tissue damage, even though those same receptors from the scratched knee example keep sending signals that there is some sort of injury to that area. What most people don't know is that there is not only a physiological component to pain, but also an emotional component, a psychological component. Our brain is what tells us whether something is pain, and that is affected by many factors, such as life experiences, social context, and our own individual reactions to pain. Some people may turn up the radio when they experience pain, ignoring the pain sensation and going on with their lives without acknowledging that there is indeed a problem. Some people may remove the warning lights and surgically remove nerve endings so they don't feel the pain, which may harm the individual in the future when there actually is tissue damage. There is actually nothing to protect us from more harm since it has been removed. There is also a strong emotional factor in our relationship with pain, based on past experiences, social context, and attitudes. The cortex in our brains is incredibly powerful and can make us perceive we're seeing things, as in the case of optical illusions and dreams. In the same way, our brains can make it seem like there is pain even when there isn't any tissue damage. As our brains are processing innumerable messages from all parts of our body, it prioritizes threats and danger or injury. So while it calculates all these messages, it determines an output response. So depending on the situation an individual is in, especially those stress levels, our perceptions of pain may differ because of the several brain structures and pathways that are going to and from the brain. Because of this, pain can be driven by emotions and our thoughts through our nervous system. So you're probably wondering, okay, Jack, so what can I do to get rid of this pain that never seems to go away? Well, I know it's probably really hard to see any good in this situation, but there has been a lot of evidence showing that each individual, including you, has the power to manage your pain by regulating your nervous system. I can be here for you as your advocate and guide. The best approach is to find the root cause and be diligent and consistent with our treatments. But be patient with yourself and try to learn from your pain. Be your own best ally. You can do this and you have the power to make the changes to defeat your pain. I believe in you.